Welcome to Paradise! While this area of the world is viewed by many tourists as a paradise away from home, let's discover what life is really like for the locals. The South Pacific is broken up into three main areas: Micronesia, Melanesia, and Polynesia. Melanesia, the region closest to Australia, include New Guinea, Solomon Islands, Fiji, New Caledonia, and a few others. Their ancestry and culture stems more from Australia. Micronesia is a region further north. This encompasses Marshall Islands, Palau, Federal State of Micronesia, and the Mariana Islands. These small group of islands make up several different countries and languages. They are believed to originate from the Indonesian area. Further east is Polynesia, the largest area and grouping of islands. They tend to be lighter skinned compared to Melanesia and Micronesia. This area has probably been the most well-known islands, including Samoa, Tonga, New Zealand, and the Cook Islands. Although not a country, Hawaii is also included in this region. Many of these people are living in less than desired conditions, using rainwater for drinking water, no electricity, and children are often not in school full-time. As a result, several islands have high rates of illiteracy. Many people are unemployed and don't have commercial banks that are willing to give out any credit, therefore limiting the opportunity for them. Obstacles like poor, ineffective government policies, lack of opportunity for economic development, small size of the economy, reliance on agriculture, and frequent natural disasters have really hindered the economy on these islands. Living on islands initially limits the land and resource access to current residents, and over time, these resources have continued to dwindle as they are used up for survival. Natural disasters have been another reason for hindering the economic growth. Tropical cyclones and droughts are among the top. These affect the stability and overall developmental progress. Not only does money have to be spent towards rebuilding after disasters, but also losses can occur in destroyed crops, building, transportation routes, and water. These areas are also having high rates of death from these disasters. Several countries are politically stable. However, that hasn't always been the case, and in some areas are still struggling with corrupt government and crime. Many of these islands are living off of a GDP less than $2,000 per year. There have been many attempts by governments or organizations trying to set up microfinance, but most have failed because of corruption or social views as this is a forced handout. Also, the governments are not fully committing to providing the health resources, water, nutrition, and education needs the citizens need, often cases violating human rights, especially gender inequality, further adding the economic struggle of many of these islands. Think of the South Pacific would automatically mouth out the words, beaches, good food, beautiful sunsets, and a tropical holiday all in one. However, behind all that goodness is a history that is still alive and practiced to this day. Ancient tattooing, dynamic dances, traditional carving and weaving, and emotionally powerful music are as evocative now as they were when traders arrived on the scene just a few hundred years ago. Clear waters, coral reefs teeming with tropical fish, white sand beaches, surf, lush vegetation, waterfalls, and the warm spirit of the people still mesmerize. While all the islands still possess great natural beauty and welcoming communities, each offers a distinctively different experience, calling adventurers to find their own special island. The Pacific Islanders live a very social lifestyle in which family members, both immediate and extended, work together in a solidified community. Their culture and life are based on ancient principles that promote living an honorable and noble lifestyle. The culture follows a saying that states, family and community centered. These islands flourish due to the fulfillment of this saying. The South Pacific region is composed of over 30 countries or groups of small islands. Therefore, their governments vary. The independent nations replace hereditary chiefs with constitutions providing for executives and legislators. In Tonga, for example, politics are controlled by a hereditary king who serves as head of state and appoints the head of government. In the nations that have entered pacts with the United States and New Zealand, the pact is for local self-government with matters of defense overseen by the foreign power. Internal self-government is also the rule among territories of overseas powers. Countries like the Marshall Islands, Federated States of Micronesia, and American Samoa, who are all territories of the United States, have elected legislators and executives. Some elected representatives are sent to the national legislature in the overseas capital. The territories are dependent on the mainland government for economic subsidies and often have little control over political decisions. The South Pacific region suffers from a double burden of disease. On the one hand, non-communicable diseases such as heart disease, stroke, cancers, and diabetes account for 70% of all deaths among the 22 island nations. On the other hand, communicable diseases, mainly neglected tropical diseases such as leprosy, dengue, and chikungunya, continue to be endemic to the region, creating high rates of infection among the population. That being said, tuberculosis, although not a tropical disease, is actually the most pressing communicable disease problem in relation to the South Pacific. For instance, data from 2014 indicates that the largest number of new TB cases occurred in the Southeast Asia and Western Pacific regions, accounting for 58% of new cases globally. So not only does this region have the highest prevalence of diabetes among adults in the world, between 1/4 to 1/3 of the adult population, it also has to combat the resulting high rates of tuberculosis. The ramifications of the disease burden within this region include a strain on the economy, in part from expenditures to provide prevention and care services for people with lifelong chronic conditions, as well as the economic loss from disabilities that result from poor health. Specifically, communicable maternal, perinatal, and nutritional conditions account for 34.6% of total disability-adjusted life years lost, and non-communicable diseases are responsible for 52.5%. According to WHO reports, barriers to good healthcare in the islands of the South Pacific include poor health and system infrastructure, brain drain and poor human resource development, a high prevalence of non-communicable diseases, the proliferation of small populations scattered across remote islands, poor public infrastructure, and a high level of vulnerability to natural disasters such as tsunamis. Most island nations only have between 1 and 5 doctors per 10,000 people. Pharmaceutical supplies are often depleted, community healthcare systems are underfunded and underdeveloped, and most health data is based on estimate. The South Pacific is sweet as bro!